So, hi, Ballari. How lovely to see you this afternoon, and thank you so much for joining us. I know you're incredibly busy, but the first thing I was going to ask you to do was, could you introduce yourself, who you are, what you do, where you live, all those kind of things.
Thank you, Sarah, for inviting me over to this interview. It's incredible to be here to be able to share the experience that we've had with the DaVinci robotic system, which we're going to discuss today. So to start with, I'm Ballari Ghosh. I'm one of the consultant gynecologists and obstetricians. I lead the gynae cancer service at Colchester General Hospital, and I've been doing it for nearly 3.5 years now. Um, just to give a little bit of a brief introduction to my role with the DaVinci robot, which we're going to talk about today. So I got introduced to the robot in about 2016 when I was finishing my final years of training. I was a fellow at the Christie Hospital in Manchester, which is one of the largest cancer centers in Europe. And I was awed by what this instrument could achieve. It felt great, not just because, it was a girl with a toy, which some of my colleagues describe me as, but it's an incredible gadget. It has huge benefits in the group of people that I look after, and they are women with cancer and precancer and women with suspected cancer. So it's a very, very a very, very anxious group of people, women with lots of medical comorbidities, surgical comorbidities, higher BMI, social comorbidities, if you like. So lots of constraints in looking after this clientele. Before we go into the details about the group of people I look after or what exactly it entails, just a brief about the robot. So the robot has been devised by a company called Intuitive, and we are very, very grateful that as ESNEFT, as Colchester General Hospital, we have the latest generation of the robot, which is the DaVinci Xi system. This instrument is actually a minimal access system, which means it helps us to do surgeries or operations with very tiny cuts in a human body. So most of the cuts that I would apply is less than a centimeter, and we do complex operation, for example, hysterectomies, which are removal of the womb, removal of the ovaries, so gynecological operations through these tiny cuts. The group of people who have the surgery under my care are women who are usually about 50, so mostly postmenopausal women. They're also a younger group of people. Most of these women have got heart problems, lung problems, they're higher BMI, diabetes. These are the group of people who benefit from a quick operating time, smaller cuts on their tummies, lesser risk of infection, lesser anesthetic time, and lesser time in hospital. Cancer is serious business, and these group of women, they keep telling us that their normal life gets hampered by their diagnosis, and having surgery and having a recovery which is quicker, because this instrument helps patients to get discharged quicker, because of what it is. The blood loss is minimal, almost like a teaspoonful of blood. And if you compare the three common modalities of surgery, whichever branch of medicine you look at, open surgery, they say it's about a cupful of blood. Laparoscopic or the traditional keyhole surgery is about half a cup. But the DaVinci robot, because of the high definition of the instrument, is about a teaspoonful of blood most of the times. So comorbidities are, so recovery is much quicker. Usually when I get to the ward the next day after the operation, my patients look better than I do because I'm tired after the operation. And I often get told, Miss Ghosh, you look a bit tired. But the patients look great, and is that's how precise the operation could be. You only operate on the damage to surrounding structures is lesser. And we were very fortunate. Two of our patients were very pleased with the outcome. They sent us videos, and the common theme was we were able to get back to normalcy much quicker than we expected. We could get back to our families quicker. We could go back to work quicker. And I think that's what makes a huge difference to the patients, because it's not what operation you do, it's how good they feel.
And can I just ask you here, when you're talking to the patients and you explain to them that this procedure is going to be done by a robot, do they become more anxious about that? And do they ever kind of say, no, 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 I'd rather that you did it? Or do you have to kind of go through a process of reassuring them that you and the robot work together?
Yeah, so it's sort of our initial experiences. I think now word has sort of gone through, word of mouth has gone around. But when we started on, it was a common theme. Patients said, so why would you leave the robot to operate on me? I don't want it. And one of our patients actually declined it in the first instance. And I was like, do you really think a machine could do the operation without my assistance? So, the robot would do what I ask it to do. So I actually operate the robot. The robot doesn't do anything on its own. And then was like, really? And then I had to show them pictures of the robot and the team to get that confidence. Some patients even wanted to see the robot in theatre before they had their general anesthetic to reassure themselves how it looked and to satisfy their curiosity. So we've had that as well. But, we haven't had any sort of adverse decisions because of the robotic instrument, but we've had questions asked saying who's doing the operation.
Yeah, I can imagine. So, I mean, it sounds absolutely fascinating and must be stretching you as well as a medical person to see this amazing instrument that you can work with. How is this going to be our future then, do you think?
So the Da Vinci robot is a very recognized system of operating all around the world. And even though, there are a handful of robotic surgeons, and that I talk for the world, because, this is a complex instrument. It requires training. It requires not just training the surgeon, it requires training of the team. But, the number of robotic conferences I go to, the number of robotic surgeons I meet, I think this is the way forward. If you see the benefits to patients, to the service, and even to surgeons. Not long ago, the BMJ brought out a report on how surgeons in their early 50s were retiring because of musculoskeletal problems, long duration of standing, long duration of stretching and all sorts. And if you think you invest so much of resources to training a surgeon, and one of my bosses said a long time ago, when you hit 50, you would be at your peak. I haven't quite reached there, I suppose, not quite there into that decade, but it is real. By that time, you've got your experience, you've done a lot of operating, and then if that's a time when, because of musculoskeletal problems, you have to retire, then it's a loss to the service. But with the robot, the surgeon is actually sitting on the console in a very comfortable position and operating. So there's no rush through an operation because you're tired. It is very dependent on the surgeon himself or herself to control the instrument, because you just control all the instruments yourself. So you do not rely on your assistant. So you then start sort of cancelling out human tiredness, any sort of human errors. You are relying on an instrument which is high, very high precision, and you're controlling it yourself sitting in a comfortable position. And the outcomes with the data that I have presented already, in Colchester, we have nearly done about nearly 70 cases over a year's time. And these are all complex patients. These are all patients with confirmed cancer, suspected pre-cancer, and on the cancer pathway. And they have all, so far, touch wood, benefited and had very positive outcomes. The oldest patient I think we've operated on is 87 years of age. So yes, I think it is here to stay. I think this is the future. And, if a future is bright and welcoming and is doing you so much good, I don't see a reason why you go back to anything else. So, yeah.
Oh, it sounds absolutely amazing. Are we allowed, I don't know if we would be, but at any time, would we be allowed to video you doing one of these operations? Would that be feasible?
I'm sure it would be. The reason I say it is because I do know that the colorectal team have had videos done for the BBC even, so the trust has allowed it, and I'm sure that is possible. So more than happy to sort of participate in that. Yeah.
That would be amazing. Ballari, honestly, thank you so much for this afternoon. I have learnt and so much. And also, I think you and I had a quick chat at the beginning. It's just great to hear positive stories in the hospital, you know, where we're jolly lucky to have this incredible piece of equipment and the people to operate these pieces of equipment. So thank you for sharing some sunshine today and for being so positive and informative. And yeah, let's have a chat about doing a video of actually seeing you in action.
Absolutely. Thank you so much, Sarah, for this. Thank you.
Oh, that's a pleasure. And as I say, I've really enjoyed just chatting to you because I knew nothing about any of this. So it's been a real eye-opener for me. So thank you so much.
Thank you.
Thank you. Bye.
Bye-bye now.